Orthopedic Oncology in Turkey. How do patients with bone cancer get assistance in Turkish hospitals? What techniques are employed by orthopedic oncologists in Turkey? That's what today's video is about. More specialized videos on various aspects of orthopedic care you can see in the playlist about orthopedic help. Direct link to it you can find in the description. And generally our channel offers many videos and interviews with Turkish doctors. So explore and find the themes you need. But I wish you not to be sick. And now, let us go meet an orthopedic oncologist in Antalya, Turkey. Bone cancer. Human being can get it at any age. In the overall statistics of cancer, this condition accounts for 1% of cases. It seems small, but bone cancer treatment requires specific skills and equipment. Only specialized hospital departments and specially trained doctors can provide them. I meet foreign patients when they need orthopedic tumor removal surgery. There are very few specialists like this worldwide. In some countries, fingers of just one hand is enough to count them. Dr. Osman Jivan, he's teaching students at Akdeniz University, and he works at one of the top orthopedic hospitals in Antalya. In order to obtain his degree, he accrued experience working in different cities throughout Turkey. Additionally, he pursued internships in Germany and Italy. Subsequently, he specialized in orthopedic oncology. For bone cancer, the orthopedic surgeon is the main doctor in charge. There are some types of bone cancer that can be cured with only surgery by an orthopedic surgeon, and they do not require radiation or chemotherapy. Chondrosarcoma is an example of such a cancer type. But there are other types of cancer, such as osteosarcoma or Ewing sarcoma. In treating such diseases, we receive support from other specialists like the Paediatric Oncology department and so on. We administer chemotherapy in advance, prepare patients for surgery, and then perform it. Following surgery, patients need to have chemotherapy again. Am I correct in understanding that removing the affected part of the skeleton, affected by cancer, is a last resort? Surgery is essential to this work. By surgical logic, the orthopedic surgeon, who conducts the surgical operation to get rid of a bone section with a tumor, must ensure no tumor cells remain after the operation. The use of chemotherapy follows a standardized protocol. It's the same in all parts of the world. And the radiation therapy protocol is standardized as well. Ultimately, the patient's quality of life and duration are profoundly influenced by the successful outcome of the surgery. Therefore, the orthopedic surgeon plays the most significant role in treating bone cancer and monitoring the results. I want to highlight an important point. If the patient's condition permits surgery, the tumor area of the bone must be removed. And this is not the topic up for debate. When it comes to orthopedic oncology, it is crucial to prioritize the removal of the tumor-affected area of the bone at an earlier stage. To an unknowing person, hearing words removal of a bone section to get rid of a tumor is terrifying. How can anyone live without part of their skeleton? However, now the medics can replace removed sections. This is the hallmark of an orthopedic oncologist's skill. After cancer treatment, they can restore the full motor functions of the patient's bones and joints. There are prosthetics for bones that are hidden from external view. We can fill the removed part of the bone with a prosthesis. Occasionally, particularly in small children, or if the tumor's spread is suitable, we remove the bone and send it for radiation therapy, and then we return it back to the body. We can also use bones with blood supply from another body part for transplantation. These are the methods we apply for bone cancer, not for soft tissue cancer. Our primary objective is the complete removal of the tumor while avoiding any intrusion into it. I frequently give this example. Think of the tumor as being in a bag. We never open the bag or study the tumor closely within it. We just remove it entirely as it stands. Hence, following a surgical procedure, there may be substantial empty spaces within the body, which can be repopulated by employing muscle folds. Muscle grafts are commonly employed to create well-vascularized soft tissues with a degree of resistance against infections, serving as a protective measure, help promote the healing process of wounds, and establish a solid base for the transplantation of skin. After the plastic surgeons perform their procedures, physiotherapists are involved in aiding the recovery process, along with some of our complementary corrective interventions. Orthopedic oncologists aim to restore the patient's quality of life post-surgery, facilitating their return to a normal lifestyle. Their primary responsibility is to precisely extract the tumor and the impacted sections of bone parts and ensure the patient's limb survives and continues to function. In highly respected hospitals, orthopedic surgeons collaborate closely with oncologists, neurologists, radiation specialists, and plastic surgeons, ensuring a comprehensive approach to patient care. The choice of treatment methods should always consider the clinical picture carefully to ensure the maximum effective outcome. Therefore, choosing the right hospital is a critically important decision. When it comes to bone cancer, it needs to be treated swiftly, but only after consulting with experts. In Turkey, you can get a free medical consultation from a special service company. The staff includes experienced doctors with legitimate diplomas and an understanding of the Turkish healthcare system.
After a person submits a request for treatment in Turkey, we, the coordinating doctors of Healthy Turkey, select the best clinic and doctor for them based on their diagnosis, wishes, and needs. As practicing Turkish doctors, we know exactly how to do this as correctly, quickly, and effectively as possible. We constantly accompany the patient throughout the whole trip, and we always stay in touch for any questions that may arise even after the patient returns home. We also talk a lot about our work on our Instagram account. You can subscribe to our Instagram via the link or QR code to get to know us better and, of course, to understand how our company works in general.
After meeting the doctors chosen based on Healthy Turkey's advice, people are convinced that their decision was all right. You can check patient reviews and experiences at this link. There are several reasons why patients from all over the world come to us in Turkey, especially for tumor surgery. One reason is that we can carry out any tumor operations successfully, similar to those that could be obtained in America or Europe. We are skilled in using radiation therapy during surgery, as well as microsurgical techniques. These methods allow us to transplant vascularized bones from one site of the body to another. We also have top-level technologies and opportunities in terms of materials we use. Furthermore, our joint prosthetics capabilities are exceptional, mainly because we have access to high-quality materials which greatly enhance our abilities in this field. All of this influences many foreigners' choice of Turkish orthopedics. Turkey compares favorably with other countries with its complex approach to patient care. In many other countries, each procedure often has a separate fee to pay. The Healthy Turkey company organizes medical tourist visits to Turkey under an all-inclusive system, working solely with verified specialists both in medicine and hospitality sectors. This company oversees all aspects of their work for every patient. Healthy Turkey covers everything, from consultations and arrangements with the clinic and doctor to transfers, lodging, immigration formalities, and medical document translations. There's the company's website address on your screen. There you'll find a lot of information regarding other medical help for foreigners in Turkey. Feel free to call with any questions at this phone number. All popular messaging platforms are in use. Be sure to subscribe to our channel to catch new informative videos on medical tourism in Turkey.